Good morning, I'm Dr. Kobus Viljoen. I'm employed by the Department of Family Medicine, where I have responsibilities in the primary healthcare module. I'm the module chair, and that module relates to the students' learning experience on the distributed platform, where students go to small hospitals throughout the Western, Northern and Eastern Cape to get learning opportunities working in a real rural context with colleagues who do the work there. My own background is in the rural medicine. For the 15 years before I joined the department at Stellenbosch, I worked in a rural hospital in the north of KZN. Selenia Hospital is about 50 kilometers south of the Mozambican border, right up against the coast, what we call a deep rural area. The hospital wasn't situated in a town, just in a community, and had a catchment of about 100,000 people stretching over about a 100-kilometer district. That was exciting work and an amazing opportunity for me to grow. I had the privilege of working with stalwarts in the rural fraternity, had the opportunity to develop as a person tremendously, had the fantastic opportunity to have my young family develop and grow there, and had very exciting work to do. The hospital and the surrounding clinics was really well functioning because of good management, and there was a wonderful team dynamic which made it very successful. Team dynamics in terms of rural hospitals is an absolute basic requirement, and is one of the things which lies close to my heart. To make sure that people cooperate and understand each other and love each other at work makes it possible to achieve so much more. My responsibilities at the university, as I alluded to before, relates to the primary healthcare model, but I also help out at the Rural Clinical School, also known as Ukwanda, here in Worcester. The program here, we have basically 20 students coming annually to Worcester Hospital, where they have a fantastic opportunity to learn in the different departments, supervised by consultants. I work in the hospital myself, in the casualty department. 1 week in a month I do a call at Montague Hospital, which is a little hospital. I go in on a Friday afternoon at 5, come out at Sunday night 8 o'clock, and I'm the only doc there for that time. So in that way I remain connected to what the clinical requirements are for students, and I remain excited about the possibility that rural medicine provides in terms of a fulfilling life and exciting work. The work I did before at Selenia Hospital, I have a natural inclination towards pediatrics, which I enjoyed very much, but I also learned a lot of orthopedics. For example, we had a unique hip disease in the vicinity of the hospital called Selenia joint disease. Many research papers have been done as to the pathophysiology. It still remains unclear, but basically patients have advanced osteoarthritis and at an early age need total hip replacements. My predecessor had the vision and courage to learn how to do these procedures, not being an orthopedic surgeon, and I had the privilege of learning it from him as well. So because of our orthopedic surgery, we branched into many other types of orthopedic surgery. Had the privilege of learning how to do plates and screws and K-wires and all kinds of exciting bits and bobs. So rural medicine and family medicine in general holds tremendous potential for those who are interested and want to develop in all kinds of fields. Family medicine is an exciting discipline, I think, exactly for that reason, that there's tremendous diversity. I think it also helps us to get close to people in a way which many other disciplines don't. We are supposed to be interested in people's context, in what's happening in their family, what's happening in their communities, and that somehow does bring us closer to patients than I think other disciplines often experience. So I think that is one of the big challenges in family medicine, is to get back to that place where we actually really care, where we show kindness. I was recently reminded that the word kindness is very simple to understand. It means I'm your kind, I am like you, I could be you. So that makes us kind towards people, is if people sense that we experience life as if we could be them, and that's why we care. So that is also a very rewarding aspect of family medicine, is the fact that the relationships with patients is rewarding. To be able to do the kind of work that we do and come closer to patients, get connected to people, that is in a way very rewarding in our current life of disconnectedness, where people actually only know each other on Facebook. So my responsibilities here at Ukwanda is to assist Dr. Francois Kutsia, who is a program coordinator. I have responsibility for also supporting some of the students who have gone out to the smaller hospitals around Worcester. We call them the LIM students, the longitudinal integrated model students, and 10 of them annually go to small hospitals around Worcester where they do their whole final year. I visit some of these sites once a month to try and support the students in this new endeavor. It's a new learning opportunity, quite a challenge for some of them to be responsible for their own learning. They've got the privilege of being supervised by family physicians, but even so, the responsibility to take learning opportunities and to develop is quite a challenge for students who've been used to be taught and to be told this is what will happen next. So I enjoy students, I love their company, I love the potential that they hold. They are generally fantastic people, very intelligent, very gifted in many areas, so great people to have as friends. And I enjoy having social contacts with students as well, so I love having them over for dinner at my house. Regarding the future of medicine in South Africa, I'm optimistic. Obviously, the big issue that stands to be clarified at this point is what's going to happen in terms of the national health insurance. The idea is a great one, the concept is a great concept. The funding part of it's still to be clarified, and if government really chooses to push it through, it's going to imply that there will be an added degree of tax, which will probably imply that many people won't be able to afford an extra medical aid on top. So I think that is probably going to create quite a revolution in terms of primary care and how people have to access it, because the majority of people who currently go to their GPs or the private hospital for care do so because of their medical aids and will simply not have it in future. So yeah, without getting entangled in whether that's right or wrong and the complexities of it, I think I agree with the concept. I agree with the idea the government takes greater responsibility to help people access better quality care. And in terms of how the model works out, that remains to be seen. But I think it's definitely the right direction to go back to primary health care, looking at preventative medicine rather than curative medicine. Preventative medicine is cheaper, it catches you before you fall, and does not try to patch you up once you've fallen. So in that sense, I think we're also doing the right thing in terms of training, and I think the whole new curriculum which has been developed is very much slanted towards that. My advice to students would be to enjoy your student time. It's a fantastic opportunity. It's a great time of your life. But remember to do your studying. It's a demanding course, but remain optimistic. I know that there's a tendency towards people to talk about how miserable the system is and how hard life is and how hard it is to be a student and a young doc. Those things are sometimes true, but remember that a little bit of a challenge and an adversity can be quite a rewarding experience if you take that on. So don't get caught up too much in the negative sentiment. Rather look at the fantastic opportunity which has been afforded to you and take the bull by the horns. There's an opportunity for you to develop in terms of family medicine into such a wide field, and it really is rewarding work, especially in terms of rural medicine. I would encourage students and say, put yourself out there, go for this experience. Don't complain too much if they send you to a place that you've never would have chosen for yourself. It's a wonderful opportunity to learn. I myself was in my community service sent out to Ukwanda. At that stage, Ukwanda, which is in the news because of the former president's home, was completely unknown and off the grid almost. I couldn't find it on a map even. But what a wonderful experience that I would have never chosen for myself. So go into it with an open mind, go into it with a sense of adventure, and you wouldn't be disappointed, I'm sure. So thank you very much.